And is everybody able to see my screen in the PowerPoint?
Yes.
Yes.
All right. So, welcome everyone. Thank you so much for being here today and for taking some time out of your busy schedule to learn a bit more about PA Med and also to hear from um, a very important person from our foundation. My name is Avery Crott. I am part of the PA Med membership team along with my colleague Janet Thompson. Unfortunately, I will be presenting solo today as Janet had to step out for a family emergency. But I hope you still find value in this call. I encourage you to ask questions, whether you would like to interrupt or also send something in the chat. I will be keeping my eye there as well. And I do apologize in advance for how my voice sounds right now. I am battling a bit of a cold, but I am going to try my best to sound okay for everyone. So as we go through this presentation, I just have a couple questions posed that I would like you to think about, brainstorm about. So what are your biggest practice issues? What keeps you up at night, and how can PA Med better serve you? And these are just a few questions that really help us to get an insight on what our members would like to see from us as PA Med. What resources could we be offering that we maybe don't right now? And to just get a better understanding of our membership and your wants and needs. So very briefly, I do want to introduce our 174th PA Med president, Dr. Kristen Sandell. This slide will be changing soon as our 175th president, Dr. Lynn Lucas Fame, will be taking into her term very soon. But before her term is up, I did want to share her initiative as I think it is super relevant for physicians and very important to talk about. Dr. Kristen Sandell, during her presidency, has been working to revitalize the profession of medicine and to restore the joy of practicing. You know, she mentioned that COVID and way before COVID, physician burnout has always been an issue. And, you know, it doesn't do much to say, oh, go take a walk, go exercise, go do A, B, and C. She was really passionate about trying to get to the root of how we could really try to minimize burnout and to share with physician colleagues their joys in medicine. You know, it takes 5 seconds to list a negative, but maybe 30 seconds to list a positive. And she just really wants to hone in on all the good things of medicine, and really taking physicians back to why they got into medicine in the first place, which is to care for their patients, and to help people. So I just wanted to bring that up quickly as her term will be ending, but I do believe this is a very important initiative that we are still very passionate about. So PA Med, when we think about it, we like to categorize it into three different kind of bubbles, if you will. So we have member engagement, physician leadership, and our organizational components. And I'm going to go through very briefly throughout the three different bubbles, so you guys can understand a bit better of what makes up PA Med. So the first little component we have is our member engagement, which of course I'm passionate about all of them, but for me being in membership, this is a big one. So we have our foundation, which I'm going to skip over as we have Dr. Kim on the call, who will be talking more about that. But I do want to bring it to your attention that that is part of our member engagement section. We also work with our county medical societies. So whenever a physician or a administrator joins PA Med, they will automatically become a member of their affiliated county medical society. So whether that be the society or the county where you work or where you live, you will automatically be a member and be able to have not only our resources, but also what they offer as well, which is pretty cool. We also have our teams, which sometimes is a bit confusing to explain as it's a part of PA Med, but in a way it is its own separate entity. So this is our events planning side. So for a lot of our national organizations, this is where our teams will help to plan conferences and different meetings and webinars and things for some of our bigger organizations. We also have our PAC, which is our Political Action Committee, which is where our members can become more engaged in our political priorities and to really help to change legislation regarding healthcare in PA. And we also have our partners, which we have definitely expanded our partner list, some of which help with malpractice insurance, contract review, OSHA compliance, things like that. We do have a lot to offer that I feel that sometimes our members might just not be aware because it's not explicitly stated. But I would be more than happy in the follow up to this call to provide a link to all of our partners as they do provide discounted services and special offerings to our members that we do like to put out there. Our second component is our physician leadership. So, of course, we have our board of trustees, which is comprised of a variety of physicians who hold leadership roles. So we have some trustees who are on our board that are representing a certain specialty or a certain district. We also have positions where our medical students or our residents can hold positions on the board and kind of relay what they learn back to the sections. We also have our House of Delegates, which is our HOD, which actually just happened this Friday and Sunday, which I think is why I'm a bit sick. It was an amazing event. It's a great time to meet all the members, to collaborate. And this is where our members are able to pose resolutions to PA Med. And this is really what guides our mission and our values going forward. And as staff, the HOD really helps us to hone in on what we need to focus on to ensure that our members have the resources they need and that we're focusing on what is most important to them. Additionally, we do have committees and task force. And just to give a quick example of a task force, we did have an emergency department overcrowding task force, which was a part of Dr. Sandel's initiative, as she is an ER doctor. And we all know that the ER is a whole nother monster in itself. And she really wanted to bring to the attention the overcrowding issue and how that not only affects patients, but the physicians providing care. And the individuals on the task force were actually so successful that now it's at the Department of Health and that they're taking it on separately. So I do want to bring that up that there are opportunities to get more involved and to make a bigger difference outside of PA Med. And we also do have special sections, which our physicians and our students and our residents can get involved in, which I will be talking about in a later slide. And lastly, the third little component or bubble, if you will, is our organizational components. So these are really the different departments that help make the vision and the mission come to life at PA Med. And this is where a lot of our useful resources can be found. So our healthcare operations team is amazing. Our administrators and our physicians find a lot of value in connecting with them. This is our team where it's really based on practice support. So whether you need help opening a practice, you're closing a practice, maybe you need guidance on EHRs, maybe you have a patient who is coming in trying to look for medical records or things like that. This is where they come into play. Also, prior authorization. If practices are having issues connecting with big insurance companies, which I know is always a problem, this is definitely a great resource to look into. We also have our continuing medical education departments or CME, which this is a perfect time to bring up as I know that our DOs and MDs are going through the process of renewing, and I know that can be a very complex kind of process to go through alone. So as a PAMN member, we are here to help you and to guide you. Some of our CME, just to mention, we have our DEA training, our opioid courses, our child abuse CME, and we also have courses that will help to maintain patient safety and risk management. We also have some other resources from our CME that is mentioned later on that I'm going to talk about. We also have our communications, which is where you receive a weekly newsletter from us known as The Dose. And I do ask that if anyone here today, if this is the first time you're hearing about The Dose or you have not been receiving it, please reach out in the chat because as a member, that is a resource that you should be getting weekly. And I would be happy to help address that if you are currently not getting that. But our dose is where, as PA Med, we like to share a lot of upcoming events coming up, any hot topics, any webinars, some achievements maybe our sections have had. And then we also have a special legislative edition every third Thursday in the month, which will come out and it has kind of these thermometers where it will measure how important a specific legislation or a bill that is being looked into at our Capitol right now is, and that we encourage you to take action and to act on that. And kind of moving from that legislative dose, we also have our advocacy in our legislative department. So each year we have different advocacy priorities, and that is all based on what we think will be relevant to our members and to healthcare in Pennsylvania. And our legislative team works tirelessly at the Capitol in Harrisburg and tries to form those connections with our legislators who we think will help to benefit our PA Med members and physicians. So as I mentioned, I knew we had another slide about our special sections, just to get a bit more in depth. So we do have six sections as of currently. We have our medical students section, our residents and fellows section, our early career physician section, our international medical graduate section, our women physicians section, and as of recently at our HOD, I'm pretty sure our independent practice physicians caucus section, we have actually passed to make into a section, as we have noticed that there is a lot of traction and popularity in that section due to all the challenges that are facing independent practicing physicians. Uh, as Janet and I, my colleague, we personally staff the MSS, RFS, and IMGs. We do encourage you, if you fall into any of those categories, to please get involved. It is a great place to collaborate with colleagues and to kind of talk with people who have shared interest or who are at a similar stage in their career. And it's just a great place to get together and make those connections. We also have more CME resources, which is awesome. One thing I do like to point out is we have a PMed Licensure Resource Center, which is extremely helpful this time of year. So in the upper left-hand corner here, there's a little screenshot and we have our license type listed out. So if you're active, if you're retired, if you have to reactivate your license, we have a bunch of FAQs that help to answer those common questions. We also always list our education requirements, again, whether that's for active or retired physicians. We have a tab for contact information, not only for PA Med, but for the State Board of Medicine, as well as the Pennsylvania licensing system. So we have a bunch of these resources at your fingertips. And of course, we're always happy to connect you with our CME department directly if you have a question that you don't seem that it's answered on our website. Additionally, we do have a checklist for license renewal, which I apologize, it is a bit blurry, but there is a clearer image further in this presentation, but it helps to generally list out the 100 credit hours that are needed specifically for the 2023 to 2024 licensure cycle. And then on the side, it does just show a couple of our CME offerings, like I mentioned before, in like our child abuse and our patient safety and risk management courses. And we have a bunch of other things to offer as well. So this is the licensure renewal checklist that I was alluding to. Again, I will be including this in follow-up as I just think it is a very valuable resource, not only for our physicians, but a lot of our practice administrator members have also found value as, you know, sometimes physicians are just extremely busy. So they're going to come to the person that they think knows all the answers, which is their administrator. So we love to also share this resource with them as it specifically lists out the DO requirements versus the MD. And this is a multi-page document that does include direct links to some of the resources I had mentioned. So our CME offerings that have fulfilled these requirements, as well as our CME Licensure Resource Center, our FAQs and things like that. So don't worry, I will be including this in follow-up just for your convenience moving forward. So obviously, as a membership organization, one of our top priorities is learning the best ways to connect with our members. And one of our easiest ways is through the member website account, which will take you to the welcome portal. So if you were to go to our website, there's a top little where it says login or join. Once you log into that with your associated username and password, that will allow you to have free range of our website. And I do like to mention this because I think a lot of the times our members might forget that you do need to be logged in to access all of our courses. As we do like to keep a lot of our resources member exclusive because we do appreciate you know, your time and effort and the dues that you pay. So we want to make sure that only our members can view certain things on our website. So please just keep that in mind. Additionally, there's the dose again, which please feel free to reach out, whether it's now or in follow-up. If you don't receive the dues, this is a very informational newsletter that I encourage you to receive. And in terms of being heard and connecting with our physician leaders, we do like to highlight that. Of course, we encourage you to reach out to PA Med staff, but we do understand that sometimes it's just kind of a different connection when you reach out to physician leaders, and we want to offer that to our members. We want to make sure that they know they have that resource. And this will be found under our Be Heard and Connect with Us, and it lists all of our board of trustees. We also have another page where you can connect with your Direct County Medical Society executive if you have any specific questions. But we do like to highlight that many of our leaders are passionate and they want to connect with our members, and we really, really encourage you to do so because that's how we move forward in PA Med. Lastly, our PMED Member Inquiry Center. This might be a little confusing. It used to be known as the PMED Knowledge Center, but we have recently went through a bit of a revamp. So it is called our Member Inquiry Center. But if you have any questions, whether that be you may have forgotten your password, or you're trying to find a CME course and you don't know where to look. Maybe you're interested in some of our leadership opportunities, but you're not sure how to get involved. This is where you can submit a contact us form. You'll simply put in an email, a phone number if you would like, and the reason you're reaching out. And me, along with a couple of other staff members, we rotate and man that weekly, and we always try to get back within 1 to 2 days. So I would encourage, if you have a very time sensitive topic, to please reach out there as we are very customer service oriented. And lastly, probably one of my favorite things to talk about is how we recognize our PMN members, which is through our awards. Personally, I have only had the pleasure of being with PMN for a year now, but I have been able to present a couple of the Everyday Hero Awards, which you can see on the right of your screen. We also have our Distinguished Service Award and we have our Under 40 Awards, which those two are annual awards. We did just honor them back in September, I believe, and it was a marvelous event. We had physicians being honored and their families there. We had dinner. We recognized everyone individually, and it was just a great time to come together and to really take time and appreciate our physicians and all the hard work that they do and the sacrifices out of their personal life that they take. So I just like to bring this up. These awards specifically, our Everyday Hero Award is open year round. We try Janet and I's goal. We do try to honor once a month. I am located in Hershey and my colleague is located in Erie, so we do try to cover the whole state if possible. But we do like to mention that these types of awards are open year round. And our special awards, so the Under 40 and our Distinguished Service Award, are only open for a certain amount of time. So please keep an eye on that. There's always promotions going out in our newsletter, The Dose. But we want to honor these physicians. So I encourage you to submit your nominations. Patients can submit, family members can submit, other physicians can submit. So please just keep that in mind moving forward. And I just wanted to bring up a couple of upcoming member opportunities. We do have our independent practice physician section monthly call. Anyone is welcome to attend. We highly encourage any independent practicing physicians, as a lot of the topics covered are very obviously relevant to what you are doing and the challenges you are facing. We also have another Membership Matters Connections call coming up November 26th. They're always at the same time, so 12 p.m. to 1 p.m. And we are currently in the process of finalizing one of our partners to speak with us. So if you're interested in learning a bit more about some of our partners, I would highly encourage you to register. And then looking a bit ahead, so December 10th, we have our Physician Leaders Virtual Journal Club, which is a great place where you can get some CME and talk to some physician colleagues about some scholarly articles. So if you're interested, I would encourage you to register. And we also have several other events on our events page. And help us help you. How can PA Med help you? We really encourage you to reach out. I will be sending out again a follow-up email. I'll be including both Janet and I's contact information. But we are here for you. We want to hear from you. We want to improve our services, and we want to learn how we can better connect with our members. So please reach out, whether that's a question, you have an idea, or feedback. We do urge you to do so. Um, if anyone at this time has any questions, I would be happy to answer them. And if not, I would love for Dr. Kim to take over the floor. But does anyone have any questions before I hand it over? And again, I am very sorry about how I sound right now. It's not the best. But seeing as there are no questions and I don't see anything in the chat, Dr. Kim, I will stop sharing if you would like to share your PowerPoint and take the floor.
Sure. Thanks, Avery. And your voice sounds just fine. That'd be great.
Thank you. And I will also be keeping an eye on the chat, Dr. Kim, if anyone has any questions throughout.
Thanks. And thanks for pointing out so many of the different facets of PA Med. And it's a good reminder, even though we're a part of PA Med, sometimes we forget just how much the organization does. And you've reminded me to engage some of the services myself.
Well, I'm glad.
Yeah.
That's why I'm here.
So I'm glad to be a part of this call. My name is Ed Kim. I'm an addiction psychiatrist by training, and I am one of the three medical directors with the peer assistance monitoring programs, um, which are housed under the foundation of the Pennsylvania Medical Society. Traditionally, the foundation hosted the Physicians Health Program. Our program has expanded, and I will go over what that change looked like in just this past year. Uh, some objectives here. We want our members and healthcare professionals to know the importance and intersection of confidentiality when physicians are seeking help from the Physician Health Program. We want to give you an important update regarding revised licensure application questions regarding an impairment resulting from an illness. And lastly, I'd like to share uh, the expansion of license types that the foundation has brought on board, um, and adding to the PHP um, to create this peer assistance monitoring program group. So, what is a physician health program? Um, One way to conceptualize this is by looking at our mission right there, which is to promote early identification and facilitate rehabilitation of physicians and other eligible healthcare professionals and the trainees with concerns related to substance use disorders, mental health disorders, and/or behavioral concerns. Uh, our goal is to coordinate assessment and treatment, as well as provide the monitoring and advocacy to ensure the safe practice of the profession, as well as the safety of the public. Um, at the core of how the PHP operates is the utmost um, attention to confidentiality. Confidentiality is really at the foundation of our model. It really is implemented in a way to reduce barriers such as the stigma, shame, and fear that we know that's associated um, um, with physicians trying to, recover from an illness or actually even seek help for an illness that can lead to an impairment. What we have found is that one of the barriers um, to physicians and trainees for seeking help was the stigma associated with seeking help, or even acknowledging that there was the possibility of someone having a substance use disorder or mental health concern. Part of the reason, or part of the stigma came actually from licensing questions that we all have to face every couple of years. Um, Previously, before this year, the question read as, since your initial application or last renewal, whichever is later, have you engaged in the intemperate or habitual use or abuse of alcohol or narcotics, hallucinogenics, or other drugs or substances that may impair judgment or coordination? So right then and there, you see some loaded language, and this is framed in a way that really kind of targets uh, and one aspect of an illness that doesn't really lead to, um, it begs the question, why is this being asked of me? And in fact, we find that just, speaking with licensees and trainees across the Commonwealth, that this very question gets in the way of seeking help. If I have a substance use disorder, or if I've misused substances, then this is viewed in a way that might interfere with my license because it's showing up on my application. So this gets down to the root of um, what many medical boards were finding, not only in Pennsylvania, but across the nation. So Um, Actually, before the pandemic, there had been some momentum for change, but it was really during the pandemic where we saw this come to light and a lot of change starting to build up. So at the national level, the Lorna Brain Heroes Foundation really implemented a campaign to educate and advocate for medical boards to start looking at this stigmatizing language. In many states, Pennsylvania was not alone. Many states had some type of stigmatizing language in their question at some point or another. So they're huge advocates for change at the national level. Here at the state level, members of the foundation of the Pennsylvania Medical Society also understood the importance of destigmatizing help-seeking behavior and also the presence of an illness. Pennsylvania Medical Society obviously was a huge part of implementing that advocacy at the proper for the proper audience with the proper stakeholders. And finally, what that culminated in was the actual change from the medical board to adopt new language, and not just for physicians, but for all licensee types um, under the licensing boards. So the new language for 2024 for MDs, DOs, and other licenses actually reads, are you currently suffering from any condition for which you are not being appropriately treated that impairs your judgment or that would otherwise adversely affect your ability to practice in a competent, ethical, and professional manner? So we we really admire what the licensing board has done with this question. This really takes away any kind of question of past use or past illness. It really targets what's happening here and now, and it also it focuses on um, what we're really trying to get at, which is you as a physician or an applicant, trainee, uh, even if you have an illness, which may or may not be causing an impairment, are you getting treated for that? And are you getting connected to the help? And are you able to work in the profession um, in a way that makes sense? So we applaud this change. This is adopted from model language from the Lorna Brain Heroes Foundation, and Pennsylvania is glad to join many of the other states that have implemented this change over the last 3 to 4 years. So we really ask, how does this impact me or my colleagues? Well, um, we don't know yet. The goal or the aim is that um, we are not pushing physicians or trainees underground. This is a move to help, not to stigmatize, to actually to destigmatize any presence of an illness, including substance use disorders or mental health concerns, and really encourage people to consider some type of help. What's going to be key as we move forward is that information and transparency remain as priorities when individuals come and participate in a PHP. And we're going to go over what the PHP actually looks like in just a second. Um, but really, for the individual, we provide a service. We hopefully it'll be less stigmatizing by not having to face potential review by a medical board who is not a treating entity. Um, Hopefully, you can address your health issues in a private and confidential matter, as any other citizen would do, or any other patient or individual. For the individual, confidentiality is upheld. Uh, we want you to be able to ask for help, to ask for resources, to get into treatment, to address your recovery in a way that really doesn't involve the licensing board unless absolutely necessary. And we design it in a way so that hopefully you can engage in our services before you it gets to the point where you really do need us. We work with a lot of practices and health systems. We have yet to see how this will impact the greater community. But again, the goal is that we're creating a pathway for confidential care, connection to resources, and really trying to get help um, without some of the barriers that physicians face or the fear that they face within their health system or local community. So in short, the PHP, what's paramount is that services are confidential. From the moment that someone reaches out to us to the moment that they end their time with our service, what we provide is confidential. Our work is supported uh, and protected by what's called peer review protections. And so we're not a medical entity, we're not a treatment provider, and our records are not discoverable. Um, so what the PHP does is essentially provide case management. We hope to further educate physicians, trainees, administrators, supervisors, health systems on the nature of recovery from an illness that can be treated. Um, what we'll also do is, based on this individual circumstance, we will provide referrals for evaluations and treatment from very specialized facilities or practitioners who actually specialize in provision of care for healthcare professionals. We can provide monitoring to help increase accountability for recovery and to ensure that treatment is going okay. And we also provide advocacy, which is respected not only by the licensing board, but by health systems, by employers, residency programs, medical schools, all included. Really, our goal is to provide early detection. The presence of an illness does not equate to impairment. And in fact, the sooner that we can identify an illness and engage someone in help, we think that we can prevent that progression to an actual impairment, which may or may not impact a physician or trainee's work and potentially put patient or the public in harm's way. We accomplish this by completing a thorough assessment and possibly referring for an evaluation. We do follow an abstinence-based model where we can really support individuals through an abstinence-based model from where they're not engaging in any substance for as a coping mechanism for whatever illness, or actually an abstinence-based approach to a substance use disorder. We do offer long-term monitoring, again, to help ensure that recovery is going well. And we collect documentation. We collect documentation of many things, but importantly, someone's abstinence and also compliance with the agreement. It's the documentation here that we compile and uh, uh, carefully compile that we turn into advocacy for other stakeholders. Originally, the foundation helped physicians through their PHP. Over time, we've helped, we've incorporated other clients or specialties, including medical students and residents, dental professionals, PAs, veterinarians, podiatrists. And as of October of last year, we brought on pharmacists as well as pharmacy trainees and students. At the same time last year, what we implemented was a sister program called the NHP or Nurses Health Program, which um, essentially adopted the PHP model to all nursing professionals. That includes clinical nurse specialists, certified registered NPs, licensed dietitian, nutritionists, LPNs, RNs, and nursing students. And the reason, and why did we decide to bring on new licensees? I think at our core, what it comes down to is the healthcare team. It's not only physicians who are seeing individuals or treating individuals, it's the whole health. I mean, it's the whole healthcare team. And really, if all members of that healthcare team are healthy, we think that conveys the best chance of efficacious care for our patients in the Commonwealth. Key takeaways here. Each individual that engages with us or reaches out, we handle it with care. Um, we handle cases fairly and equitably. We do invest a lot actually in each individual's progress. We utilize best practices and evidence-based models. The PHP and NHP really align ourselves as partners in the recovery process and in trying to get help. And what we know is that monitoring does save lives. The PHP model, time after time, has demonstrated that unlike many other treatment modalities, really has a success rate that helps physicians and other healthcare professionals really achieve recovery and maintain that. When we see physicians and other healthcare professionals um, achieve a level of satisfaction in their recovery and be able to stay engaged in their chosen profession and thrive, I think that's a sign that we've done a pretty good job. I would encourage you to visit um, uh, this this video, which is posted on our social media, called "Bringing Wellness and Recovery into Focus." Really, really nice 4 or 5 minute video, very well produced, and you'll get the sense of what what the PHP model can do for an individual and how the individual just can thrive through participation. Once again, we would like to thank you for your membership at PA Med. Um, as always, you can always reach out to some staff and you'll be connected to the appropriate service. If you'd like to jot down the PHP's information, you can reach us Monday to Thursday at either of those numbers, or simply email us php-foundation@pamedsoc.org. And I think we have time for some questions. Is that right?
Yes, that is right. That was perfect. We have about 15 minutes left. If anyone has any questions for Dr. Kim about the foundation or the PHP or the NHP, so I'll leave it open. And also, if you don't have any questions right now, because it's kind of on the spot, please feel free to respond whenever I send up the follow-up, as Janet and I can connect with Dr. Kim if there are any questions that arise after the call as well. I know sometimes it's hard to think of a question right on the spot, so we totally understand. Dr. Hannah, I saw you unmuted. Do you have a question?
I just wanted to make a comment. I just wanted to thank you, number one, for the work that you're doing, and also Dr. Kim for the work that you're doing with the physicians. And I really think that that's important for the physicians who have impairment or risk of it, that they feel that they can seek help without jeopardizing their career. So that's a major change. Thank you for that.
Thank you.
Yeah, I agree. I think this was a perfect topic to have, especially as we approach licensure year. It's important that our physicians and our members know that these services are available. As many people might not even be aware of the foundation and the good work that they do. And I will be sending, if it's okay with you, Dr. Kim, your PowerPoint, as I know it has that helpful video in it. So if anyone's interested in kind of looking into that further, they'll have the ability to do so. Um,
Does treating patients with, or physicians with depression and suicidal risk, is that part of your program?
We, we, yes, in it, yes, we want to make sure that anybody struggling with a mental illness, even if it gets to the point of, suicidality, want to make sure that they're connected to appropriate care. These are trying times for the medical community, and um, what we see on the surface of our colleagues is usually just the tip of the iceberg of so much suffering, and the amount of turmoil that's going on inner in that individual. um, they often don't know who to turn to, and actually, as a colleague or a peer, when you start to see those signs, it's difficult to think of how to help, right? Or if you begin to engage with that individual, or you start tugging at that string, what are you going to unfold? And if that happens, as physicians, we always want to advise, right? We always want to have an answer or a solution. And I think some type of treatment or confidential resource is the key. Um, things like burnout, the demands of the healthcare system on our physicians and trainees, they all stand to exacerbate, um, the same mental health concerns and substance use disorders that affect anybody. So the increasing demands, the complexities of how all this interplays together, um, that's where we thrive,
Yeah,
right?
I guess I've never served in the military, but I guess that concept of, nobody left behind. So those
mhm.
soldiers, they take care of each other out in the field because that's who they have to rely on. And so it's the same physicians, as you say, obviously our goal is always to take care of patients, to be seen as um, super strong and, and not weak and not show any weakness. But really, we need to take care of each other and recognize that we all slip and fall in the mud now and then. But we pull each other back up and get to the objective, so to speak. Use a military
Mhm.
term again for the work you're doing.
I appreciate that. I like that analogy, that first one, and I think you hit it on the spot. Um, yeah, it's almost as if you had glimpsed into one of our uh, team meetings where we're discussing individuals and how we can best help them. So, very, very wise statements.
Thank you. I'm not usually accused of making wise statements, but
Uh, Well, thank you, Dr. Hannah, for your thoughts. Those are definitely very helpful and something we should all be thinking about. Um, but if anybody else has any questions, I welcome you to ask them now. If not, feel free to reach back out to me when I send the follow-up at some point this week. But thank you all so much for staying on the call. And thank you, Dr. Kim, again for coming on. This is a very important topic, and I'm happy you were able to join us today.
Thanks for having me.
Yeah.